listening to the myPET podcast, the show for pet lovers of Australia and around the world.
Hi, you're listening to the myPET podcast. I'm Aria and I'm here with our resident vet, Dr. Glenn.
Hello.
Now, everything is, of course, just general advice. For advice specific to your pet's need, have a chat to your vet.
Correct.
We're here to talk about gross stuff yet again.
Good old parasites.
Parasites.
With their weird life cycles.
Their weird life cycles and the really gross stuff that they do.
Creepiness.
Their absolute creepiness. We're just trying to, we're not really, but creep people out into using parasite prevention. It's the horrors that...
Yes and no.
No.
Yes. Yep.
No, we're not. That's a joke. So they're commonly called, colloquially called neckworms.
Yep.
But that's not necessarily the most accurate name for them. Is that right?
Yes and no. So, neckworms are in the neck in their adult form. So we're talking about horses, we're talking about parasites that are in and underneath the skin in horses and cause itching and self-trauma and ulcerative wounds and other bits and pieces. So there's a couple of different parasites that cause similar but different lesions. Yes.
Yeah. So there's two species of worms that we're talking about.
Yep.
One of them is Onchocerca.
Correct.
And the other one is Habronema.
Correct. You've done well.
Thank you. I practice a lot. So let's start with Onchocerca because these two have very different life cycles.
Correct.
And they also have very different symptoms, but kind of similar.
Different but sort of crossing over.
Yeah.
Yep.
Onchocerca.
Yep. So Onchocerca, which is the neckworm, it is in its adult form in the nuchal ligament, so the big connective tissue elastic band that attaches to the withers, to the pole and all the neck on the horse that makes it more able to keep its head upright without using all its muscles, basically.
Yep.
It's just a big rubber band that's really thick. The adult worms end up in there, basically, and they are breeding and curled up in little encysted little capsules, and they're up to 60 centimetres long, which sounds really gross, to be rolled up in a little ball.
Crazy.
And they mate and make babies up in there, and the babies end up in the bloodstream and go to where in the body they are most likely to be picked up by biting insects, because that's how they spread from horse to horse or back to the same horse. Mm-hmm. So the Microfilaria, or the little microscopic baby worms circulating in the bloodstream, end up usually in the ventral, so the undercarriage of the horse, so underneath the belly, underneath the neck, sometimes up on the head, and sometimes on the top of the neck, but it's mostly on the underside, and that's where they're most likely to be bitten by biting insects, midges or biting flies, basically. So those biting flies go off and infect another horse with the Microfilaria through their biting mouth parts, and then that worm ends up going through the horse's bloodstream and ends up in the neck and becomes an adult, and the life cycle is complete.
So, you often see the word microfilaria.
Correct.
Yes.
Yep.
You often see that written on deworming boxes and things.
Yep.
But it's not actually a separate species of worm. It's just the baby
It's just
ones.
the life stage of a worm that circulates through the body, like the dog heartworm has a Microfilaria stage where it is underneath the skin in dogs and it's bitten by mosquitoes, and that's how dog heartworm spreads around through Microfilaria. Elephantitis in people is a different type of Microfilaria, so the human body has a reaction to the microscopic little larvae underneath the skin, and you get big lumps and hunchbacks and stuff. And that's another Microfilaria disease.
That's very interesting.
So there's lots of different parasites have Microfilaria stages, but they're just waiting underneath the skin to be bitten by biting insects of some sort. Yep.
Just lurking.
And they're, if it was just the Microfilaria, it would not really cause a great deal of problem, because the neck worms in the neck weirdly don't, or very rarely, cause any problems. They just sit there and live there for 1 year to 10 years, depending on who you listen to. And there's the adult worms, and I mean, a lot of these parasites haven't actually had that much research done with them, and haven't actually had like recent research done with them. Like most of the published papers are from the 1970s and 80s and 90s sort of thing. But the microfilaria, the problem they cause is the horse has an immune system reaction to those microfilaria and causes itchiness and lumps and reaction to maybe it's to the old microfilaria that are too old and they're waiting around for too long and don't get sucked up by a body insect and they just die.
Yeah.
And then we think probably the dead worms cause more of an allergic or an inflammatory response. So you tend to get these lumps and like tufts of hair coming out and little oozy mucky bits basically, and maybe that's part of the progression of life cycle as well, because if you've got an oozy, crusty sort of sore, well, the biting insects are more likely to come in there and be attracted to that.
They love
perpetuate
the life cycle. Oozy sore.
Yeah. So, and that's a problem. And then one of the big problems is, okay, we give a wormer to kill intestinal parasites in the horse, and that wormer doesn't kill the adult worm at all in the neck because it's in this little encysted form. The body sort of puts connective tissue around it, and that stops any of the worming medication to get in there. And again, it's in the body. A lot of worming medications don't actually get absorbed in the body. They only kill the intestinal worms in the gut. But the mectins, like the ivermectins and abamectins and moxidectins, they do kill the microfilaria. So it stops transfer of the infection if you kill the microfilaria. But in some horses, in killing all those little microfilaria, that causes an intense allergic reaction. So 24, 48, 72 hours after you give a mectin wormer, if your horse starts ripping itself to pieces, scratching its undercarriage or face super intensely and traumatising itself, there's a pretty fair chance it had neckworm, it had lots of microfilaria, they all died at once. Body has a big allergic reaction to it, and you need to call your vet to give them prescription medications topically or orally to help them stop them chewing and tearing and ripping themselves to pieces.
Yeah. I often get asked this by people, how do I know if my horse has this?
Yep.
So it sounds like if they do, it's a pretty intense reaction.
It's a pretty intense reaction, and that's like the most spectacular form of it. If you give the wormer and they become intensely itchy, but some horses are just low grade or moderate grade itchy all the time because of the microfilaria that are going through the life cycle. So there's sort of two different scenarios. You've got the chronic lower grade form of the illness and then the acute onset itchiness post worming. Yeah. But you can't not worm them because if you don't worm them, well, they're still going to be bloody itchy anyway.
Yeah, that's right. Yep. Yeah. But yeah, I guess this is something, if people suspect that their horse has Onchocerca, they should be contacting the vet.
Probably, I'm never going to say don't contact your vet. I mean, diagnosis is difficult as well. So, I mean, you can make a presumed diagnosis from the clinical symptoms, which realistically are pretty non-specific. I mean, crusty, oozy lesions on the underside of a horse. I mean, is it from the biting insects that are biting it there anyway? Is it from Onchocerca? Is it from Habronema, which is the other one we're going to talk about? Is it, Culicoides, Queensland itch midgie sort of bites? Or is it from grasses and pollens and all the other things that horses come in contact with? I mean, if you get that intense itchy reaction post-worming, okay, it was probably Onchocerca. But if you need to get, to specifically diagnose it, you've got to take, or the vet's got to take a skin biopsy under sedation and send it off to the lab and get histopathology done on it and look at it under the microscope in sections to look for these little microfilaria. That's the only way to definitely diagnose it, because you're not going to look for the adults by cutting open the top of the neck.
No.
And you can occasionally see it on x-rays, little calcified lumps around the adults, but I mean, again, that's an incidental finding when you're x-raying the neck for something else.
Yeah.
So, I mean, it's a problem that probably goes officially undiagnosed nearly all the time, but a presumed diagnosis of one of these parasite-based skin conditions is often made, and worming and insect control, which we'll talk about later, is the two main things you can do about it.
Okay, and true or false, Onchocerca causes decreased mane growth and tail growth?
very unlikely.
Yeah.
Yeah, so, I mean, main growth, I mean, some of those little microfilaria might end up on the top of the neck, but it's more so the underside of the neck. Tail base, really, really, really unlikely because they don't accumulate there because there's not many things bite around there in the insect world, basically. So, I mean, tail base and male is far more likely to be Queensland itch, allergic reaction to the Culicoides midge bite. So that's the most likely, tail and mane problem. If it's itchy tail on its own, is it pinworms, which is another parasite that causes perianal irritation. But if it's neck and tail, it's most likely to be Culicoides, but it could be pinworm at the back and Onchocerca at the front, potentially. So they're complicated. But it's unlikely that neckworm would cause tail and neck itching. Yeah,
okay. Yeah. So, are you ready to get on to Habronema?
I can move to Habronema.
You can move to Habronema. So what symptoms do these cause?
So Habronema, it's another type of parasite. It's actually a gut worm.
Okay.
So the adults in the gut gets pooped out in the poop. The maggots of flies in the horse poop eat the larvae as part of the fly larvae life cycle. Maggot turns into a fly. Fly has the larvae of the Habronema in it. That fly goes and either bites a horse around its mouth, maybe, if it's a stable fly, but it's mostly like it's a house fly, like a normal house fly. They're just incidentally flying around a horse and flies into the horse's mouth, or dies in the horse's food, or dies in the horse's water trough, and the larvae of the worm end up eaten by the horse in one of those ways. Larvae ends up back down in the gut and becomes an adult over time, and maybe occasionally causes gastritis and a bit of discomfort for the horse, but the adult worms probably don't do much at all.
Yeah.
So that's the way the worm wants the life cycle to go.
Yes.
The flies, because flies do fly things, if they are buzzing around a horse's mouth, or if the horse has got a oozy, crusty wound from whatever, or, horses' eyes are always covered in flies if there's flies around, and around the muzzle and the nostrils and the mouth. Male horses around the prepuce and the sheath. Female horses to a lesser extent at the back end because they've got a tail to help out. Yeah. So if there's a wound, or if there's an open mucous membrane, those flies can actually transfer larvae just from the fly feeding behaviour. So you end up with the larva of the hopefully gutworm in the wrong spot, and the horse has an immune reaction, and seems to be quite an intense immune reaction to those larvae being in the wrong spot. So you get these ulcerating, open, really nasty looking wounds around eyes, lips, nostrils occasionally, and penis and prepuce of male horses predominantly. Yeah. And they can be really nasty and be confused sometimes with skin cancers. Like if you've got a pink skinned horse, they can just look like a skin ulcerating, horrible skin cancer basically. And you can't tell from the outside either. So they're sort of a bit the same as the Onchocerca in that they cause skin lesions, but they tend to be more so confined to mostly eyes and prepuce and around the mouth. But if you had a wound somewhere else, it can have the same effect.
Yeah, okay.
So you can't say definitely for sure this is a Onchocerca or a Habronema just because of where it is and what it looks like, because there's that bit of crossover. Yeah. But if you've got an ulcerating, prepuce lesion, well, it's more likely to be Habronema. If you've got an ulcerating eye lesion, when I say eye, like it's on the eyelids or in the medial canthus where the tear drainage bit is, so anywhere where flies accumulate, basically, yeah. So different but the same. Yeah.
So treatment for them is...
Treatment is the same as in the mectins kill the worm. I mean, sometimes if you've got a nasty ulcerating wound, it can take an extended period to heal up. They get these like clunkers, these little cheesy, horrible rock-like dry pus things in that wound where the body's trying to expel this foreign material, which is what the larvae are.
Yeah.
And sometimes they stay there and inhibit healing, and your vet will get in there and sedate your horse and squeeze these chunks of crap out, and the wound will heal faster because of that. But I mean, a lot of the time you've got to again take a biopsy of the lesion, because if it's a pink-skinned horse, you're worried about, okay, is this wound parasite based or is it a skin cancer?
Yeah.
And the only way you know for sure is to take the biopsy and do the diagnosis. If your vet chose to treat the parasitic burden through worming, etc., and supported them with wound healing bits and pieces, skin cancer won't get better by itself, whereas the Habronema lesions can, or usually do, but they can take some time because they're so angry and active. Yeah, and then the more biting insects you've got and the more flies you've got, maybe the further north you are, and then the early lesions can sort of look like fungal infections that we get, like swamp cancer is a terrible name, but like fungal infections that eat tissue can look like Habronema lesions early on sometimes as well.
They look so uncomfortable.
Oh, they're horrible.
Things. They're really horrible.
Yeah, and intensely itchy sometimes as well. So then you've got what was a small lesion, and they start, traumatising their face, eyes, nose, or penis. Yeah, and some of them end up on the urethra, right at the urethral prominence on the sheath, and they start. Some of the first symptoms that people see is their horse back legs is just covered in wee because they've got this lump at the end of their penis, which probably doesn't necessarily get inspected very often, and they're just showering pee everywhere because they're not doing a good stream of urine. It's sort of half blocking off the urine flow.
Oh dear.
So it gets nasty.
Yes, it really sounds like it.
Yes.
How do you... Is this very common?
I am not in full-time horse practice or any horse practice anymore, but yeah, I've practiced in Queensland and Northern Territory, and I used to suspect a lot of cases. I can't remember if I actually ever officially diagnosed them, as in taken biopsy samples and sent them off to the lab. But yeah, I used to see multiple horses every wet season / summer season with lesions that were suspicious of it, and you'd treat them, and most of them would go away with the mectin-based wormers, and some of them needed other supportive care and sometimes the anti-inflammatory medications to stop them tearing themselves to pieces. Yeah.
So what's the best way to prevent this?
Consistent worming would help. So the Habronema, if you worm the horses often enough, every 2 months or 3 months, depending on what the long-term persistence of the mectin-based worms that you're using is, that would at least reduce the amount in the environment. Because flies are associated with its transmission, they don't get back into the horse without flies being involved. Fly control, the environmental fly control, and fly masks and rugs and repellent sprays, basically. So the less flies around the horse, the less likely they are to get the Habronema and the Onchocerca. The less biting insects they've got, the less likely they are to transfer them back as well. So it's a combination of worming medications and repellents and masks and rugs. Basically, that's the only way you've got to control the life cycle.
And with the Onchocerca adults, they can hang out in the neck and they're not controlled by any of these mectin-based wormers.
They just live out their life cycles because they're insisted. They're in the body, but they're sort of outside where druggers can get into them. But they usually don't cause any troubles either. Occasionally they end up in weird ligaments, in fetlocks and suspensory ligaments in the wrong spot in the body, and occasionally get picked up in surgical cases or ultrasounds and that sort of thing. But it's pretty much the adults. No, you can't fix them. You can only help to prevent the horse being reinfected through controlling the microfilaria and controlling insects.
Do the adults keep producing Microfilaria?
Yep.
Yeah. Okay.
So they'll keep going. So a single dose doesn't kill the adult and kills whatever microfilaria is circulating then, and depending on what they are, they'll kill microfilaria for a couple of weeks or several weeks, but they'll keep reproducing, and those microfilaria, the new babies, will end up in the bloodstream and potentially be infectious, or potentially be there to cause the itchiness still. So they'll keep happening. Okay.
So if you've had a suspected case of that, then
you
pretty much
probably
just
need to keep using mectins at a regular basis.
Yeah.
And be guided by your vet if you've got a specific, case that they're treating.
Yeah.
But at least every 2 to 3 months.
Yeah.
Yeah.
Yeah. Well, yeah, they're like all parasites, very unpleasant. But I feel like these ones aren't spoken about that much, and there's sort of not that much general knowledge about them.
Probably not, because they're not. There's very little gut consequence. And I mean, a lot of horse parasites are worried about colic, which is horrible in horses.
Yeah.
And these are very unlikely to cause that. Well, the Habronema, which is the gut parasite, is very unlikely to cause gastrointestinal problems.
Yeah.
But it causes the skin trauma and cancer-y looking thing troubles.
Yeah, so it's interesting to know a little bit more about them and to sort of understand how they all work. So thanks for sharing your knowledge.
All good. Weird life cycles.
They are weird life cycles, yes. The Habronema is very much the old lady horse who swallowed a fly.
Yes.
She didn't know why.
No, but she won't die.
She won't die.
No.
She'll be okay.
She'll be fine.
Yeah.
Yep.
So if you suspect your old lady or old man horse has fly, she'll probably be, you don't know why, but she'll probably be okay. Just have a chat to your vet.
Sounds good.
Thank you.
Thanks, guys.